Before I even knew what it was, cancer was the most substantial factor in my entire life. At the age of 4, my sister was diagnosed with glioblastoma multiforme, a type of cancer that grows from glial cells that form supportive tissue in neurons. It is fast-growing and hard to detect, which is why it led to my sister's demise. My family watched as their little girl stopped being able to even smile. In the end, all we could do was ease her pain. I watched as she died in my father's arms. After that, my family was never the same. My father didn't love his children as much. My mother became mentally ill, and I decided to dedicate my career helping families such as mine. 2,500 years ago, Hippocrates coined the term cancer. At the time, the only treatment was diet, leeches, and laxatives. 25 centuries later, and the life expectancy is about the same, 12 months. This is because of the unique structure of the disease in every individual it possesses. We are not just trying to cure one disease, but billions. Before going into a potential cure, we must first address misconceptions in science. Since the Enlightenment, we have lived in a science-based world. It is simple, logical, and rational. However, science is not 100% fact. It is not constant, and it is not perfect. Famed scientist James Burke, known for his philosophical discussion about science and technology, once said that even the most apparently immutable system or structure may be experiencing change even as you look at it. We can only progress if we embrace change in science. We cannot believe we are all-knowing, or else we will never be able to improve. Next, we must also address misconceptions in the field of cancer research. Every tumor develops differently and can originate in any type of tissue. While there are only 5 main types of tissue, they can be further subcategorized until there are millions. It is commonly said among cancer researchers that cancer is not a single disease as much as many different things with many similarities. Today's common cancer treatments include chemotherapy and ionizing radiation. Chemotherapy destroys the cytoskeleton of cells so they are incapable of division. Ionizing radiation destroys cells' DNA beyond recognition, so copies cannot be made. Radiation is targeted at specific locations in the body where cancer is most prevalent. Often, the goal of these treatments is to minimize the surface area of the tumor so surgeons can remove it. Surgery has proven to be most effective. There's also been success freezing and heating the tumor so it cells in nature. This method only works if the cancer is caught early and has not metastasized. There has also been some results with injecting live virus into the tumor. However, it is difficult to stop the virus from spreading to healthy cells. The most promising cancer treatment we have currently is genome sequencing and personalized medicine. By comparing the genetic makeup of healthy cells to cancerous ones, doctors can identify mutations at the root of tumors. They can also map the genetic evolution of cancer, monitor a patient's response to treatment, and classify tumors based on their genetic makeup instead of location. This assists in individualizing treatment, leading to the new idea of personalized medicine. For example, in a clinical trial of women with stage 3 breast cancer, researchers discovered they could use genome sequencing to determine which patients would respond to which drugs. Genome sequencing started with zinc finger nucleases and transcription activator-like effector nucleases, or TALENs. However, that was proven to be expensive, inaccurate, and ineffective. This led to the invention of CRISPR by Jennifer Doudna and Emmanuel Carpentier. CRISPR allowed researchers to easily alter DNA sequences and modify gene function. This method was developed from the natural defense mechanisms of single-celled microorganisms who use CRISPR-derived RNA to foil attacks by foreign invaders by chopping up and destroying their DNA. In this way, we can use CRISPR to mark the mutations that cause cancer. Then CRISPR RNA will transcribe Cas9 and guide it to destroy the mutated portion of DNA throughout the entire body. Thus, we could destroy cancer by destroying the mutations causing cancer with little to no side effect. Dr. Jai Luo did a series of experiments to learn more about genome sequencing. In doing so, he identified targets for cancer drugs by constructing a library of RNA that guide the enzyme Cas9 to druggable areas of human genome and create a population of RNA with one gene god. This experiment led to many important conclusions. For one, they were able to identify genes that were important to the growth and survival of cancer cells. Secondly, he enhanced the expression of existing genes to study their effect on cellular function and to test their ability to drive cancer growth. Additionally, he differentiated between necessary and dangerous mutation. Also, he determined which genes drove cancer cells and which ones normal cells could live without. And finally, he identified and prevented the steps that cause drug-resistant cancers. Johns Hopkins Institute for Clinical and Translational Research did a study on genome sequencing and its effects on patients with pancreatic cancer, which demonstrates a specific example of the possibilities of genome sequencing. The study consisted of 101 patients with stage 2 pancreatic cancer. Researchers collected tumor and normal DNA. They then surgically removed the tumors and analyzed each nucleotide base over 750 times to ensure accuracy. The team reported 98 of the patients had mutations in traditional genes, such as TP53 and CRAS. Drugs used to target these mutations are known to be ineffective. However, 38 patients had other mutations that could be treated by unique drug therapies, demonstrating the potential of personalized medicine in cancer treatment. These patients survived 5 years longer than predicted and had double the survival rates. The trial produced substantial results. However, clinical trials must take place on a larger scale in order to ensure accuracy. Genome sequencing and personalized medicine are by far the greatest hopes we have for curing cancer. However, there are some fallacies. To begin, genome sequencing is expensive. It currently costs about $1,000 per genome, down from $1 million in 2001. Additionally, it is difficult to perform large scale. There is also the fear of the creation of drug-resistant viruses. Genome sequencing captures only one mutation in one specific location. However, mutations occur constantly. We are not capable of catching everything. There is also the danger of off-target genetic alterations and their consequences. Additionally, we don't know the long-term effects. This could lead to unwanted adaptations over time. Many would argue that we shouldn't be determining what is good and bad, since humans in history have often been wrong when addressing the question of morality. Such is the argument of Rosita L. Narcisse, who states genetic treatment may easily be twisted to support prejudice and discrimination against others. She goes on to use an analogy that compares two children who have the inability to grow taller. The doctor in this scenario is forced into a moral debate within herself. Should she give growth hormone to the kids to make them taller, since people who are taller are proven to be more successful? Additionally, in the 20th century, many of the leading researchers believed that poverty and crime were causes of people with bad blood. This view could lead to the altering of entire races or cultures, bringing to light a new fallacy of racism. What if Hitler had had access to genetic engineering in his concentration camps? Regardless of these risks, we must strive to enhance our learning in genome therapy and personalized medicine in order to prevent the destruction of families such as mine, in order to prevent the death of children who should be playing with their sisters, in order to prevent death that is entirely preventable. We must solve the problems as they come in order to save daughters, sisters, and families. Thank you.